projects that have been created to solve problems caused by COVID-19. From Hailey Mah in the Feminist AI to Ashley Moe, Emmy Gu, and Aastha Shukla from the Knowledge Society, and finally Elsa Bosemark from SafeBites. Our panelists have created amazing inventions and tech-related projects, and we are so glad to have them speak to you. Hopefully they can serve as a source of inspiration of what your projects can look like too. And with that, let's get started. If the panelists would like to introduce themselves and their projects, that would be wonderful. So yeah, let's start.
Hi, my name is Aastha Shukla, and as you said, I'm from the Knowledge Society. I'm actually an innovator in the Knowledge Society, so it's been about 1 month into the Knowledge Society, and I'm really learning about biotechnology and different aspects like gene editing. But today I wanted to talk about my project that I did about several months ago, which is about the impact of COVID-19, and I studied the impacts of COVID-19 in rural communities.
Well, I guess I'll go next. So hey everyone, I'm also from TKS, or the Knowledge Society, but I'm in the second year program now, and I've really been looking into novel COVID diagnostics and also like a lot into lupus monitoring as well. And I love biosensors. And I've been, over the summer, I was working on a project with Emma to create this algorithm that could detect COVID in forced cough recordings. And it's like AI powered, and we had so much fun making it. And we're from Toronto, Canada, by the way.
Hi, I'm Emma, not from the Knowledge Society, but I'm really interested in coding. So this has been, I guess, like a few years into programming. So as Ashley said, me and Ashley worked on a machine learning algorithm that's able to detect COVID through forced cough recordings. And it has been really fun, learned a lot about AI within those 2 months. So yeah.
Hi everyone, I'm Elsa, she, her pronouns, and I'm actually from California Bay Area. And the project that I worked on was, so giving some context, freshman year, I joined a girls in tech club at my school. And in sophomore, we were doing it virtually, and I was just talking with members. And one of the members was explaining how her dad owns a restaurant. And during COVID, it was not doing very well. And a big issue was the restaurant was putting a lot of time and effort in making the restaurant like safe by putting like all the hand sanitizer, taking away tables, but they couldn't show it to customers what they were doing. And it's funny because I'm not really sure how it happened, but something just clicked in like the group. They were like, what if we actually developed a solution for that? And something I really liked about it is that we had the dad that we could talk to, and it was someone from the industry to get some feedback. And off of that, like we'll talk about it more later if I get the opportunity, but long story short, we created an app called SafeBites that kind of helped with seeing like what restaurants were doing to protect you. And it was kind of like a review app, except not for food, but for COVID prevention methods.
Hailey, feel free to go.
Right. Yeah. Hi, everyone. I'm Hailey from representing Feminist AI, and my pronouns are she, her. I'm calling everyone from Vancouver, Canada. So happy to see that there are other Canadians in the room here. Basically, Feminist AI is a group where we work to put technologies into the hands of different folks of all different ages and backgrounds in order to try and create accessible AI education for everybody. So we've been doing this work for a few years, but during COVID, obviously the pandemic has forced us as an organization to really rethink some of the different types of like education programming and workshops that we can do. And a lot of our activities have kind of been reoriented towards creating kind of a communal space where people in our community can like share their experiences with COVID recovery, in addition to all of our different topics that we're talking about, like the social impacts of artificial intelligence and feminist approaches to search and different technologies, and also integrating kind of everyone's personal experiences during COVID into that as well. So yeah, super happy to be here and to hear about all these other projects as well. So nice to meet you all.
Likewise, thank you so much. I believe Emma and Ashley and then Aastha all have presentations that they would like to give. Panelists, feel free to share your screen and go right ahead.
So we start?
Yeah.
Awesome. Awesome. That took a while, but over the last 2 years, it's hard to believe that something like this killed millions of people. It's been on the loose all across the world, and at this point, the only way to wipe them out is to track every case. However, while testing efforts have increased, they haven't increased enough. Testing is a key tool to find the infected and isolate them to ensure that those with COVID-19 don't move on to spread the virus to more people. It's possible that the pandemic will come to an end sometime in the near future. And while vaccination is extremely important, we also need to ramp up testing. We're seeing the appearances of new variants, which need to be tracked and isolated as fast as possible before they become completely immune to the current vaccine. For our current testing, there's the gold standard PCR test, which is a 3-hour lab procedure and usually costs about $75 each. Time and cost amount, so it is very difficult to scale this globally. Additionally, there are startups working to create rapid at-home test kits. However, they still usually cost over $5 each, require some level of testing reagent, and those taking the test may take it incorrectly, leading to higher inaccuracy. Meanwhile, at schools, including ours, students fill out a COVID-19 questionnaire only asking for physical symptoms. However, up to 50% of people with COVID can be asymptomatic. So this method doesn't ensure that a student is healthy. Despite rapid at-home tests available, most schools don't have enough money to order them for students to take daily. So we thought, what if we could make a test that didn't cost anything, that didn't require testing reagent, and just took 1 second? This would allow daily testing to be scalable even in low-income areas and schools, which is what led us to think of using machine learning as a helpful tool. So we thought, what if we could make an algorithm that would take an input like a forced cough recording, analyze that cough, and be able to tell if the individual has COVID or not?
So a little bit on how we built it. We took roughly 4,000 forced cough recordings, half from people with COVID and half from people who were healthy. And then we essentially converted each audio recording into a spectrogram, which is basically a visual representation of that audio over time. And then we use that as input and we put it through a convolutional neural network, or CNN, which is basically a class that's specialized for image processing. And in a nutshell, it acts like a filter where it's able to analyze the image's raw pixel data and then sort of extract features from that data and then associate features to spectrograms of people who had COVID and then people who were healthy. So this is the fun part. Emma's going to play a video demo of our model. There we go, it's loading. Okay, so essentially what we did here is we took 2 forced cough recordings, one from someone who had COVID and one from someone who was healthy. So what she's highlighting right now, that was just the file name. And it basically processed that audio, turned it into a spectrogram, went through the entire model, and it spit out the result, which was healthy. And so that, in that case, printed out the correct result, which is really exciting. And then we put in a file that was COVID, and then it predicted COVID. So we were really, really excited about this project, but we thought that we should mention many of the limitations of our model. And overall, we actually only got about a 65 to 70% accuracy rate. And this was mainly because of the lack of quality data online. So, you know, like getting 4,000 recordings basically meant that we had to scour the internet to get data from everywhere that we could. And this meant that our data wasn't necessarily the most uniform. And also not all the coughs were proper coughs. Some of them had weird background noise. We did try to code some machine learning algorithms to filter out that data a little bit, but it wasn't perfect. And so this made it really difficult to get a high accuracy on the model, as our model was not learning from the best data. Another fundamental issue is there are questions on whether or not it's even possible to differentiate between, you know, like regular pneumonia, flu viruses, and COVID, because they ultimately all affect your lower respiratory tract in very similar ways. So you would expect very similar sounds that even AI potentially cannot differentiate. And so with the second issue at hand, since September, Emma and I have actually shifted our focus a little bit. And instead we're detecting things like pneumonia, COPD, and asthma versus like viruses. And we chose this because these are diseases where you can actually hear a difference. Usually doctors would like listen to people inhaling during their physical exam, and, you know, would be able to diagnose pneumonia if they had a crackling noise, or like, or diagnose tuberculosis if there wasn't a crackling noise. And because humans can hear this difference, it's very likely that AI is able to do this even better. And so now we're aiming to implement this app in low resource communities, targeting Uganda to make diagnosis a lot more accessible there. So that was a little summary on the project that we did. We made this COVID algorithm over the summer. We put our contact info up just in case. And yeah, I think now we open the floor to questions.
We'll be having a proper questionnaire panel session a bit later, but if there are any quick questions right now, let's feel free to put them in the chat and we can go over them. And these are all great questions, but I believe it would be best to address it at the end, since we'd also like to get to some of our questions too. So Aastha, can we get your presentation?
Yeah, I'm just going to be speaking on what I've done. So I'm just going to start off with the kind of a personal connection here. In the beginning, when COVID did start, my family, the rest of my family is in India. So it had a big impact in the village that my family was in. And I was able to see that firsthand because I was talking to my family members, listening to their stories, listening to how everything was going on there. And their experience with COVID in India, in a rural village, which doesn't have access to accurate information, doesn't have access to clinics that can give them resources, it was a very rough time. And so from that information, from that personal experience, I was able to give a presentation or give a report at the New Jersey Chemistry Olympics competition. And like, you might think that because it is a chemistry competition that I would be talking about like the mRNA vaccines and all the different proteins and all the different organelles and all of that stuff. But I actually tried to make my approach more about the impacts, the social impacts of COVID, because that's something that I was aware of. And so I was able to give a presentation to them. And my main points and my main focus was about misinformation and also the different resources, how resources in high-income countries vary to resources in low-income countries. And so I'm just going to speak a little bit about it. So even though the vaccine development and assessment has gone a long way right now, some challenges pertaining to vaccination still remain, and the vaccine process requires many, many steps. So that would be to manufacture, to distribute, and to administer the vaccine. So of course, there would be individuals wondering, like, how safe is this vaccine? There are obviously valid worries. And so that's where the misinformation started in villages like mine, where they don't have governments that are really passing down information. And there's also misinformation in social media. And vaccines have very big job to accommodate a diverse range of ages, ethnicities, and different groups. There are so many different clinical trials. And so it is really hard to achieve herd immunity. And the fact that this was done with the COVID vaccine in a short amount of time, whereas other vaccines would take much, much longer, would produce that worry. And so I really talked about misinformation in my presentation, really about how those governments that are in those local areas are not giving the proper information to their residents, to their locals. And so because of that, there's a lot of worry and there's a lot of fear. And so I talked about those differences. And after that, I'll talk about the project that I worked on during the summer this year, actually. I got to intern with the team from Mt Sinai Hospital. They specialize in prostate cancer. And they did a project on AI and prostate cancer and also COVID. So how does COVID affect prostate cancer? And they used AI to measure that. That project is not finished yet because I've only worked there for a month, but that's something that I've done. And today I just wanted to mainly talk about that misinformation aspect, because that is a personal connection, and also that's still such a huge problem today. I mean, many people have said certain things about the vaccines that are not true. And so I'm working on different ideas that I could possibly turn into a project relating to misinformation. And also I'm going to keep working on that project with the AI and prostate cancer and COVID. So thank you so much for listening to me. And those are my project ideas.
That was really great to listen to. Now that we've heard a few presentations and anything else, Elsa and Hailey, if you wish to add anything on there, you can, but otherwise we can move on to our panel questions. So yeah, is there anything you'd like to add, or I can move on to the panel questions?
I can add something because I feel like the questions might not answer it, but so I kind of gave context like where SafeBites came from, but we did it in the summer of 2020 and the team is pretty busy. So what we decided to do was to participate in a hackathon to help us give like structure and like the mentorship to help develop an idea, which is why I just want to say like congrats to everyone here that is doing a hackathon. They are really great experiences to take an idea and just like test it out. We like the team that I was in, it was like 5 people. For others, we did the MIT App Inventor Hackathon, and that was a really cool one because you use block code. So it's like super easy. It was just about testing the idea because again, we didn't really know if there was a demand for it. Except another thing that's nice about this one, it was a week-long hackathon versus like usually they're 24 hours. So that gave us a lot of time to like work through it and again, do some research. What was really fun or kind of unexpected, but in a delightful way, is that we actually did win first place in the youth category, which was funny because I was just like in the car with my dad and I looked at the phone, I'm like, wait, what? And I was looking at my dad, I'm like, what? So it was really like, what it really was, it showed that there was an interest in this. And that was huge because it just validated the idea pretty much. Whoa, I see Hailey little trophy. I didn't know that was an emoji. Okay, sorry. One thing led to another, and I don't even know also how this happened, but we ended up being interviewed by CNN, and they just talked about the project, about like different things people like youth were doing about COVID. What was awesome is that it allowed people or allowed us to connect with other people who were interested in the app or want to support the app. So it's like, this is just to say that, again, you're doing a hackathon, you never know where things are going to lead you. So just keep at it. Even after the hackathon, we didn't want to drop it because that can happen a lot. Like we just start an idea, nothing happens after the hackathon, and like we didn't win anything, whatever. Careful. If you found a good team and you have a good project, I say like, pursue it. We pursued the SafeBites and we actually like expanded the team. We were able to find mentors. We actually reached out to the chief of staff at Yelp who mentored us for the SafeBites, which is like, you never know where things can lead you. So just like test it and just like persevere, even because we were doing it during school year, and that can be a challenge with like juggling schoolwork and then trying to do like stuff with other people. It can be challenging, but just meeting with people regularly. I like teams because it's like accountability. If I were doing this alone, maybe it wouldn't have survived, but because we were a team and we depended and we relied on each other, it actually really helped, go through the obstacles or go through like the not so fun parts because we were doing it together. So yeah, that's just something I want to pitch in. Like, hackathon's cool, teamwork, really, really great, especially during COVID because it's easy to get isolated. So yeah.
Thank you so much. Hailey, would you like to add anything?
Yeah, sure. I know that time's creeping up, so I'll try and keep it quick. And also, I feel like a bit of the auto note here because our organization, Feminist AI, doesn't exactly have like a project that was built around COVID response. Instead, we've kind of been doing work around education around artificial intelligence and social impacts and doing research for a few years, but COVID totally threw things for a loop. We used to do in-person workshops and activities, everything had to move virtual, all of our timelines changed. So rather than pitching like a whole new project, I kind of just, the perspective I'm coming from today is basically just the idea of learning how to maybe take an existing project or an existing idea and trying to sort of reimagine it within the era of COVID and make it flexible and make it suited for anything that, society or the world can really throw at us. That's kind of, that's kind of our perspective. So just wanted to basically encourage everyone to really take into consideration that kind of flexibility that the world has shown us that we really need. And also to consider different qualities like, burnout and like funding capacity and like resources and stuff like that, because I think that COVID has really shown us that all of those things can sort of just like, go up in a big blast. And that's really important to keep in mind, especially as you're creating new projects. Yeah, I'll just keep it at that because I know we're running out of time, but it's so great to hear about all these projects.
Thank you so much. Okay, now that we've had a few words from our panelists, we're going to start off with the questions. We are a bit over time, and so we'll be pushing this workshop to 1:30 p.m. Because we'd still love to get a bit more insight from our wonderful panelists. Okay, so the first question that most of you addressed is, what is the problem that you really worked to solve, and why were you inclined or inspired to pursue that specific problem? We can start off with Emma and Ashley.
Awesome. Actually, I can answer this question. So last year in grade 10, I stayed mostly online, but when we were going to school, we realized that the only thing stopping students like with COVID to go into school was like 10 questions that asked, were you sick? Did your stomach hurt a little bit? Do you feel tired? Do you feel kind of sick? Do you cough? And it's like, at that moment, we realized is that there really was no protection for any of the students in there. You go in there, you're hoping no one else is sick or feeling sick. And that was the only protection. We actually looked at an article that MIT wrote, and they basically created a model for an AI project similar to ours. And we got really inspired by that. And we wanted to like delve into it by recreating it, but using the data that we were able to find and also the information that we were able to collect. So yeah.
It's really wonderful. Aastha, would you like to go next?
Yeah, so the problem that I focused on, as I said, was misinformation. It originated because of the fact that I heard about personal experiences through my family members about how misinformation was such a big deal, especially in areas where there's not a lot of where things are being spoken word to word. So not through sources that are credible, but more like mouth to mouth gossip, things like that. So that's something that I did want to tackle because I just couldn't bear listening to that, especially because COVID is such a big issue and rumors and false information can really take a turn for the worse. So I decided to do something about it, like do a presentation about it. because I really wanted to address that problem. And as I said, in the Chem Olympics competition, they had two different initiatives for us to take on. It was either talking about the chemistry part of the vaccines or the misinformation and the social aspect of the vaccines. And so the social aspect was something that I focused on, even though it is Chemistry Olympics. But that was mainly propelled because of my personal experience. And I'm thinking of, I have a few project ideas relating to misinformation, but I'm on my robotics team. I'm the CEO of my robotics team, and we work with many teams internationally, such as South Africa, Nigeria, Ireland, Turkey, and many different countries. And I'm really thinking of doing a project idea and talking to them about it. So that's how my project originated, and that's where I think it's going to go.
Wonderful. Elsa, you're up next.
Yeah, something about the Girls in Tech Club that I really like is that we have this amazing opportunity to learn how to not just coding. I think when I say girls in tech, it's automatically coding, but it's just different roles in the tech industry, like marketing, researching, business planning, all that stuff. And then coding is also part of it. But the thing is that we get to learn these amazing skills, and how can we also share that almost and not just keep it for ourselves, but actually use these private skills for a public purpose is something we like to say. And so we've created apps before, but here it was very much again, when you create any idea, you never know how helpful it's going to be or how people are going to take it. And this was really just based on there was a very direct issue, and we're can we actually use technology to solve something people not going to restaurants? Is that possible? So it's kind of this curiosity and challenge, and wanting to just try it a little bit and test and see what happens. So yeah, that one, again, a big thing was that we had people we could talk to. And because of the dad, he was part of that industry. It made us a lot more confident in what we were doing because we could get that really nice feedback. So huge shout outs to him. So if you can in my opinion, if you can talk to people that have experiences in whatever problem you're trying to address, it also helps. Maybe I have a different experience with restaurants compared to Ashley. Maybe Ashley has a different experience with restaurants, or Hailey has a different experience with restaurants. So it almost also avoids my own biases being bled into the app. Whereas I can make sure hey, someone who actually owns a restaurant, is this something that would make it harder for you? Because people can be kind of harsh when reviewing, or will it actually help you? So it's stuff like that. So careful with assumptions, and just talking to people was a big part of what inspired this in a way. So yeah.
That's amazing. Hailey, on to you.
Yeah. So like Aastha, Feminist AI and our organization is really interested in kind of the social impacts of COVID, and that's kind of what I can speak to from personal experience as well. So for us, the problem that was caused by the pandemic, again, was kind of the major interruption of all the different types of activities that we were doing in person and on certain timelines, because, everyone had to move online and lots of things got postponed or delayed and that kind of thing. So for us, as an organization, one of the big problems that we had was that because we're volunteer run, a lot of people were dealing with burnout, other types of family commitments, and illness and lack of resources and stuff like that. So really making sure that everyone in our community could be supported, and that we could make sure that no one was being put on with too many things that they couldn't deal with while a global pandemic is raging. That was one big problem that we're still kind of trying to figure out as an organization. And then on another problem caused with COVID on the more public facing level is taking all of these in-person, workshops, book clubs, making activities and stuff, and how do we transfer into doing it online, and how do we try and make sure that it's accessible and engaging and that we can still reach people again, while all of these other different things are happening in people's lives too. And so a lot of that meant just like taking things a little bit more slowly and a little bit more thoughtfully and getting a lot of community input.
Thank you for answering that question, panelists. Those were all really wonderful answers. And that was actually the perfect transition to our next question. While developing your project, what is the biggest challenge you or your organization faced due to the pandemic, and how have you overcome it or faced it? Ashley and Emma, we'll start with you. Oh, sorry, Elsa. We can start with you.
No, I just wanted to like, I don't know if it was like popcorn style or something, but Emma and Ashley, go ahead, no worries.
Was it like our biggest challenge when we were building the project, or just like in general with the pandemic?
Sorry, with general caused by mainly due to the pandemic.
I mean, for me, like, I guess it was really just like, it was mainly just like not being able to see like friends. I think that was like the main thing, because like I wasn't able to see friends, but that definitely did affect me like mentally, because like I mean, like I used to meet up with my friends all the time after school in person. We would go on skateboard and all that kind of stuff, and have a good time. And then with the pandemic, it kind of got hard, and like arranging video calls is not like, I mean, at the time, like I don't really video call with my friends. And so like I was kind of like in this bubble of like loneliness. I did talk to Emma a lot though. Emma was always there. But like with a lot of my other friends, like I lost a lot of contact. I'm starting to reconnect with them now as things are slowly moving back in person here in Toronto. But that was definitely a hard time, especially since like it was like especially when I had to like push through schoolwork or other projects. And I was just kind of like at my laptop, and I was kind of like, isolated. And I mean, I think to some extent everyone has felt that during the pandemic, and I'm really happy that things are starting to go back to normal.
Do I add something? Or so
We'd like to.
Actually, I had like, cause like I lived far away from everyone, so I never met anyone. A lot different experience, but I got the COVID. When people like miss normal like society before COVID came, I hit that moment like 6 months into COVID. So it's like a really late. And that was when schoolwork began to feel like meaningless to me. And that was scary. And it's like the moment when everything you're doing doesn't matter to you anymore, that was like really freaked me out, panicked for a month. Back to normal, hopefully. But yeah, so that was like my main impact of COVID. It was just you get it, especially when you're like doing the exact same thing over and over again. It's like schoolwork. It's very easy to get really demotivated during COVID.
Yeah, and we definitely agree. Also, I saw your hands. Would you like to go next?
Yeah, I actually wanted to add on to what Ashley was saying. Like brought up like this idea of a bubble. I really agreed with that. Like being at home constantly, I felt like I was just like, it was easy to kind of get caught up in my own world. And to me, it's really important to try to be like aware what's happening, but it can also be very heavy sometimes. And I know it's also like I do kind of projects before COVID, and it's kind of, I found it like to be easier to do things alone because I didn't have to like meet with people. I wouldn't have to send emails, like try to coordinate stuff. But even though it was easier to do stuff alone, it doesn't mean it was necessarily better. In fact, it was really important that I did a project with other people and collaboratively for me, because it allowed me to, again, like get different perspectives on like how other people are experiencing COVID. Because if I was constantly like in my own bubble, it was easy just to get like caught up in what I was doing, when it's a lot about how is COVID affecting other people. And this project really allowed me to like get out of my head and start like seeing COVID for like how the team member's dad experienced it, or how the team member as like the daughter of the dad experienced COVID. And that was really important for me. So yeah. So a challenge that was a challenge, I guess, turned into what is it called? Like gift in disguise, something like that. I know there's an expression. I know it.
Yeah, it's not clicking for me either. But if anyone knows it, please feel free to type in the chat.
Oh, Hailey, silver lining. I like that, silver lining.
And Hailey, speaking of you, would you like to answer the question next?
Yeah, sure. So kind of like how Emma was saying, for a lot of our community at Feminist AI, we were dealing with a lot of burnout on our team because we're a like not-for-profit volunteer-run organization. Um, it's really hard when there's no funding for people to get the motivation to keep on wanting to create different projects and programs when there's so many other things that are happening in the world that feel so much more urgent. So a lot of that came down to listening to our community, adjusting our timelines. We had a book club that was supposed to happen right away, and especially, with COVID and like with the George Floyd protests like that were happening, we realized there's just so much upheaval happening in society that we need to look inwards, take some time to kind of reevaluate our priorities, and then like move slowly and thoughtfully through how we do our work as well. And so that was some of the ways that we faced it, as well as kind of actually, instead of just like having members of our community just get like overworked and not be able to say anything, we're starting to create community agreements for all of our volunteers so that people get to say what kinds of self-care that they need, when hours they can be contacted, and what their different boundaries and limits are, and how much work they can take on at a given time, so that people don't feel like they're being overburdened with work. They feel like instead it's something that like they are able to like contribute to, while also handling all the different parts of their lives. So making all of those different needs of everybody in our community explicit is something that we're kind of learning on the way, but it's been really great so far.
Aastha, would you like to add anything to that?
Yeah, so I'd say in general, I remember when it was like March 12th or March 13th, and our school was like, you guys have 2 weeks off. And literally everyone in our school was so excited because we had 2 weeks off. But like as several months went by, it was more like, what am I doing at home? Stuck at home, just doing homework. Because it was homework every day, and then you couldn't even go outside to see your friends. And so my house was pretty strict about that. So it was like I couldn't go outside to see friends, and it was just very constricting. But that also gave me that gave me like a new way to seek for more opportunities. And that's something that I've done on my robotics team. I've reached out to other teams, other robotics teams in other countries, got to talk to them, got to mentor them over Zoom calls. So that was a really important part. I guess it's the same thing as Elsa said, like a blessing in disguise. Like something good came out of it, even though it was a little hard in the first few months. In terms of my project, I'd say it's probably communicating over Google Meet, communicating over Zoom. I mean, it's so much better to communicate in person. You just see other people's expressions, you see their excitement about a certain topic, you guys get excited, you're talking in the same room. But over Google Meet and Zoom, like I had to learn how to like accommodate to that and to talk to other people and make a cohesive presentation for our competition and everything. So I'd say it's mostly communication.
Yeah, definitely. And with surge and volunteers handling so many people, the communication gets tricky. Mental health was a big aspect that we also covered in our first panel. So glad that we're addressing those things. And again, thank you so much for those wonderful responses. We're going to wrap our panel up with one last really important question. What do you think that we, and this means everyone in this Zoom call, in the hackathon, just as a citizen, as a general person in community, can do to help everyone recover from this global pandemic, whether it's regarding tech or not? But yeah, Emma and Ashley, like always, let's start with you guys and move on.
So we do feel that like tech plays a really important role, like all these startups are working to make vaccination or create vaccinations like faster than ever. Like the Pfizer vaccine like came out like so fast. And also, like all these startups that are working on like revolutionizing the standard PCR test to be like faster and like more accessible and can be decentralized and all that kind of stuff. And, you know, like that's really, really great. But I also think it's really important to support people emotionally, because like to some extent, we're all affected by the vaccine and we're all affected by these tests. But like I would say a lot of people are feeling, you know, like mentally down, as I think all of us like pointed out, and I'm sure everyone in this call like has felt to some point. And honestly, it just really helps to just like check up on a friend, like if they've been like quiet for a long time, or like check up on a friend that may seem like okay and who may be laughing at school, just to be like, hey, is everything okay? Like sometimes I get weird vibes from people like that, even if they seem like totally fine, but you know, something may be going on. And it's just sometimes really helpful to just rant. Like sometimes I rant to Emma at like 11 p.m. about like my problems, and I rant about the world and how like some people like piss me off and the world pissed me off and all that kind of stuff. But it's definitely a stress reliever, and it's really nice. If and honestly, like I feel super nice, especially when Emma like reaches out to me to ask if everything's okay, and just that emotional support.
I do have to add on to that. Yeah, I think it's really about supporting each other. There are definitely moments where you just rant to each other, where both of you guys have problems and you're both miserable. I don't know. I find that when you know someone else is also miserable, it makes you feel a little bit better. You're like, we're in the same boat. It's both leaking, we're both drowning, but it's okay. We're gonna figure out something. I definitely find like being optimistic is like a rare thing. Like I'm not a big fan of like being super like everything's gonna be better, but sometimes when you like see someone like feeling really down and looking really negative, it's nice to like just tell them like this is definitely gonna get over. Sometimes all your thoughts are in your head, like you get tunnel vision, you think this one mark determines your whole future and you messed up that mark or something like that. Yeah. But definitely making someone feel like things aren't worse, but yeah, definitely not toxic positivity. Like someone's issues is their issues, but you know, being able to just, you know, also able to look at the brighter side is also very nice.
Yeah, definitely. Aastha, would you like to add on or answer that question?
Yeah, I agree with Emma and Ashley. I mean, it's really just supporting each other emotionally. Everyone's in the same boat, everyone's going through the same thing. They know your problems, you know their problems, talk it out. Like, I think supporting each other is so, so important. And that's something that, like in my school, that's something that our school really excelled at, making sure that our teachers were catching up with us, communicating with us, being like, we know that you're going through a tough time, so we're going to give you a little break. We're not going to go too hard on you. And also like listening to, like communicating with each other and just supporting each other. I think that's so, so important. And also seeing what you can do. Like during that time when everyone was at home and quarantining, so many things happened. There was the George Floyd protests. So many people took it in their hands to raise awareness on social media. That's something that you could do from home. And that's something that I participated in as well. So I think really seeing what you can do is supporting each other emotionally, giving each other positive support, and then also seeing what you can do in terms of what's happening around you, what's happening in the world. I think that's something that everyone can do.
Yeah, definitely. Elsa, Auntie?
Yeah, I have to say, I feel like most people kind of already talked about this, but communicating like how you're feeling is really important because again, you don't even know where discussions can lead to. And I know at my school, like people may say like COVID was really overwhelming, but we don't actually really talk about it. We like to pretend almost that it didn't happen a little bit. But because it was like, for some people, it was really, really hard, really, really tough. Like, so it can be like really heavy topics, but just putting it out there at least acknowledges what happened and like the hardship that it caused. And something that was said that I really liked, that yeah, like if you notice anything in your community that you feel like is a problem, like everyone here, I love like that there were challenges and we didn't see them as like dead ends, but we saw them as like invitations for like creative problem solving or solutions. And what I like about that is it almost we almost can take control of our experience with COVID, where it's like, yeah, COVID was tough, but we worked together to try to quote fight it, right? So it almost changes the narrative a little bit. And of course, COVID affected everyone really differently. I would say like I was still like very lucky. I had my parents that was really supportive. I still had people I could talk to. That's not like for everyone. So I just want to acknowledge that. But yeah, if you can be there for other people, and if you can do other projects that you think can help other people, then it just gives you that, like, I don't know, there's just something about that to give you like, yeah, like we got this, we got this. So yeah, keep it up and just be there.
Yeah, thank you so much, Elsa. I just wanted to yeah, say my piece too. I think in terms of pandemic recovery on a more general level, I think that in terms of like making projects and stuff, again, kind of incorporating that like flexibility and those social considerations built in from the start, instead of trying to like pretend that everything's fine and then having to like, you know, redo everything later because it turns out that like you know, the world is still kind of in chaos. But for on a more like personal and community level, I think it's taking into account that everybody is recovering at different paces. For some people, COVID might feel like it's over, and for other people, you know, different people in parts of the world, different people who have different like health or like work conditions and like that kind of thing, that there's a lot of reasons why people might not feel like, you know, they're recovered yet, or anything like that. And so making sure that we can kind of take that into account in everything that we're doing. Everyone might be experiencing different circumstances, and trying to integrate things like equity and accessibility and transparency into all of our projects, because a lot of those things have had a lot of light shed them on during COVID, and it's important to take those lessons with us as we move forward.
Thank you so much, everyone. Those were such wonderful answers. And I'm glad that we were able to cover not only the tech aspect of how important these projects are during COVID-19 to help problems from, scanning or like detecting COVID-19